Thank you, Dr. Toomey. And let me just add to that certainly Marty and the girls will continue, myself will continue praying for all of our healthcare heroes, including our public health workers that are out there. I think this is a time for all Georgians to reflect back on the early days in the pandemic when people were delivering meals and donuts and other things to folks working in the hospital and thanking their public health workers, and that's what we should continue to do. We need to unite in these tough times, not be divided. Let's all continue to work and be respectful in the days ahead. Questions?
Announced many measures about how to combat the consequences of the Delta variant in our hospitals and help our healthcare heroes, as you mentioned. Do you think you're doing enough to slow the causes of it, to slow the spread of the Delta variant that is causing all of this?
Well, if you have any good ideas on how we can further slow the spread, I'd be open to them. Because look, this Delta variant is spreading everywhere. You can look at states, you can look at counties in state. They have all kind of different policies. You can compare, Hawaii, who's on perennial lockdown, to states in the South that are not doing that. The numbers aren't any different. The trajectories aren't any different. Same thing in a place like Missouri, which was the hottest state in the country for the longest period of time. Many counties that had mandates, other counties that did not. The Delta variant still spread. The thing we need to stay focused on, in my opinion, in Georgia, is continuing to educate people about the life-saving vaccines. Operation Warp Speed, that was created in the Trump administration, in my opinion, is a medical miracle. I'm glad I'm vaccinated. I'm glad my whole family's vaccinated. I know that there are people out there that have vaccine hesitancy for a lot of different reasons. We have them, in the African American community for obvious reasons dating back to the Tuskegee experiment. We have other people that just don't trust the government, which is why I've continued to say, talk to your doctor, talk to your local pharmacist that you trust, talk to your faith leader, talk to anybody in your family that you trust that has taken the vaccine, and make a medical decision that potentially could save your life. I mean, the numbers do not lie. 95% of the people in the hospital with COVID have not been vaccinated. And I would urge you to do that. That is what we need to unite and focus on instead of having, different mandates. And all that does is continue to divide people, make them angry, which leads to conflict, and that is not where we need to be in our state or in our country, in my opinion.
This is a question for Commissioner Toomey. Commissioner Toomey, earlier this month, the Department of Public Health issued an order saying that school districts could set their own quarantine policies. I have had some school superintendents say to me that they loosened or made their quarantine policies less restrictive after that, and they now regret that and are going back. You said a few minutes ago that you are working with school superintendents to try to combat the spread of COVID-19 in schools. Can you talk a little bit more about that, and can you talk about, in retrospect, whether you think loosening the rules on quarantines in schools was a good idea?
If you looked at the administrative order, it didn't say they could make their own rules. It said that if a child was asymptomatic, they could do a modified quarantine. And we talked about what that meant. And this was similar to what we had done with the essential workers. It was similar to what we did with migrant workers. It was similar to what we did with many of the individuals, and we did that successfully. And it was just for those cases acquired in the school, not out in the community. And that was made clear at the time. But when we realized that many of those schools were not actually following those guidelines based on reports both from our health directors and a number of parents, I issued a letter, which I'm sure you've seen because it was published in the Atlanta Journal, and as well as some explanatory information that the state epidemiologist put together. And I think that really outlined very clearly how that, the expectation of how that can be rolled out safely, which is consistent with CDC guidelines in all aspects, with the exception of that modified quarantine for those who are exposed in the school. And they are asked to wear a mask during that time.
Can you talk about what you are doing to work with superintendents right now to try to slow down spread in schools?
For those that, again, we have sent out that reiteration of what the expectations were, and we've set up a series of phone calls. We'll be having a series of phone calls with those schools that may have some questions in the coming week.
This question is for Governor Kemp. Governor, as Dr. Toomey mentioned, some counties and some local governments have seen some success in these vaccine incentives. Since you seem to oppose or veer away from vaccine mandates or any more, I guess, rigid implementation of that, would you foresee something like that expanding across the state?
Well, as I've said earlier, we've looked at a lot of the incentives. It's cumbersome for state government to do that in a lot of ways, so that's why we're taking these measures with the state health benefit plan. Given the, holiday this coming Friday, urging state employees who are not vaccinated to schedule their appointment perhaps on Friday when they don't have to be at work, or perhaps doing that tomorrow in the next couple of days where you can enjoy your day off Friday but also be vaccinated. So we're trying to incentivize through things like that, and then also the announcement today through the state health benefit plan to be able to get the $150 gift card or the available money in points to reduce co-pays, co-insurance, and things of that nature. So, we are doing an incentive, but I think, to me, the best incentives that I've seen out there have been working locally. They've been working with an individual company deciding, hey, we're going to do this with our employees if you're vaccinated. I read a great article this morning and certainly congratulate CEO Michael Thurman in DeKalb County on the event that they had down there. I think there was 2,500 people who got vaccinated. I heard there was a long line. I think that's great, and I think other local governments are doing that too. And that's really where people are going to have more trust dealing with people that they're used to working with every day or that they're closest to versus, some kind of state approach. I think the way we're handling it is the right way.
This question is for Dr. Toomey. The governor talked about oxygen supply. What's your level of concern about whether hospital supply of oxygen for COVID patients will be depleted to the point where it could be a real concern?
Well, I think because we are aware of it, we're proactively trying to address it through, and our folks in the stockpile have been working with that, and we've been working very diligently to ensure that we have an adequate supply. So I think we are aware, and the more patients we have with COVID, the demand for, or the requirements for oxygen are going to increase, and so that we are recognizing that and getting additional oxygen available.
Are there other supplies that we are getting low on that are critical to us?
Not that I'm aware of. I'd have to defer to Kaylee if she's aware from the hospitals, but I'm not aware, and our PPE supply is good.
Andy, just to fill you in, we have been hearing that from a few hospitals, certainly smaller hospitals in rural Georgia. And obviously, a lot of the supply chain is tight. We saw that with the fuel issues during the Colonial Pipeline shutdown, and that's why we did the executive order. We're trying to free up every available resource to keep trucks moving and get oxygen to these medical facilities. Obviously, just about every state in the country is dealing with this, if not at least half of them right now. And so I think this problem will continue to persist, and we just want to be doing everything that we can in our state to allow the logistics to work, so that's not the issue.
Governor, you recently announced, I think it was 1,500 new medical workers coming to hospitals across the state. I wonder if you could give us an update. Are they working now? What kind of jobs are they doing? Are hospitals finding them effective?
Yeah, I may let Commissioner Noggle answer the specifics of that. I will just say we've done that. We are literally working every day with every single vendor that we can find to hire every single person. And as soon as we are getting one of those folks, we are sending them where they're needed most. Certainly our rural hospitals had a big need, but also our metro systems do as well. But we were never under the illusion that we were going to be able to hire 15 people, in a week or two. It's going to take us some time, but that is something we're actively working on. Is there anything else you'd add to that? Okay.
Governor, maybe General too, can you elaborate on what these 2,500, potential of 2,500 additional guardsmen will actually be doing to help combat the virus, where they'll be stationed, what activities they'll be doing?
I'll kind of try to answer in an overarching view, and I'll let General Cardin come up and speak to that. But, you know, we started hearing from the hospitals that they obviously needed more medical personnel, and we've talked about this a lot in the past, but it sounds like a really good idea to have the Guard call up, you know, every medic, anybody that can give a shot, any medical doctor. The problem is they're already working in our medical facilities. So you'd be taking them out of a hospital where they're needed, putting them in uniform and sending them back or sending them somewhere else. So it doesn't make sense to do that. The 105 that he called up the other day that were folks that weren't in that situation, and I can tell you that the hospital CEOs I've talked to have been very grateful for those members. It's been a big help. It's also helping speed up the wall time, which is how long the ambulances and the EMS is having to wait at our hospitals when they turn a patient, so that's getting them back out quicker. And so that mission has been a success. But when I was talking to hospital CEOs the other day, I was like, what else do you need? And they started saying, you know, look, we could just help people, you know, directing traffic, telling people, you know, don't come into the emergency room to get a test. You can go to the health department that's, you know, 2 blocks away. You know, where do I park? You know, helping in cafeterias, cleaning. I mean, kind of any of those jobs that they just need help with, turning rooms in hospitals or serving their clientele. General, you want to add anything? Is that basically it?
So a non-medical
Yeah, these would be non-medical people. But the thing it's doing, I think, are twofold. Number one, it's helping them be more efficient in turning the bed, cleaning a room, and providing food and other things that they may not have enough people to do, or would have to pull somebody off a low-level medical service to go do those jobs. The other thing I think it's, and I've heard this from the CEOs, it's a real morale booster to let the people in the hospital know that are literally working 18-hour shifts, that they appreciate that people are listening, that they know how hard it is there right now. So I think it's been a morale boost to those healthcare heroes as well.
Hi, Governor. I know you've commented on this before, but just curious, as the situation unfolds and things get more dire, if your stance has changed. We know vaccination is the key to get out of the pandemic. A lot of kids can't get vaccinated yet. Are you recommending students wear masks in schools? We know this is a very hot debate. Just curious on your stance now.
Well, look, I'm all for anybody that feels comfortable wearing a mask. You know, if they're not vaccinated and they want to wear a mask, I think it's great. Marty and I went to an event the other day. They were requiring masks, and so we put our mask on. But I'm also glad I'm vaccinated. I think that's what we need to stay focused on. I think when you look at, you know, the mask mandates around the country, you can pull up all kind of different data that says whatever one side of the issue wants to say on that or not. To me, we need to stay focused on the vaccines. I think our schools, especially in higher ed, are doing a great job of incentivizing that, making the vaccine available to the kids. I know, you know, obviously the staff, I think most have already been vaccinated or certainly had the opportunity to do that. To me, that's where our focus needs to stay. That's what solves all issues.
Governor, I think you just answered my question. That was about the University System of Georgia and whether you could support the Board of Regents and the Chancellor reconsidering and imposing a mask mandate in the classrooms, at least for now.
I mean, look, I think the university system needs to continue to focus on getting everybody that's eligible vaccinated. I think they've done that with their employees. I think they need to continue doing that with the students, and I'm going to continue to support them to do that. I personally believe that mandates like that are only going to cause division on campus. If people want to wear a mask, wear the mask. You know, I'm good with that. If you feel comfortable doing that, if you want to try to protect yourself, protect others from you, I have no issues with that. But also know that there's a lot of people that have been vaccinated that don't want to wear a mask anymore. And to me, we shouldn't be fighting about these issues. It's just causing division. It's causing people's blood pressure to go up. We need to continue to educate and advocate for people getting the vaccine. And look, at the end of the day, there's going to be people that don't want to do that. And this is America, and this is Georgia, and you can do that. But the fact is, you're going to remain at risk of being in the hospital with COVID-19. And you run the risk of being on a ventilator. And you run the risk of being on a ventilator for 2 or 3 weeks and then dying. And that is the decision that everyone's going to have to make.
Commissioner Toomey, last week DPH sent out a release discussing the Georgia Coordinating Center and urging people not to go to emergency rooms for non-emergency situations. Can you talk about what message you were trying to convey with that release?
The hospitals have been overwhelmed with people coming to the emergency rooms. And in fact, if you look at our surveillance data that just looks at emergency room visits, we have just huge spikes, the highest, frankly, that we've ever seen reported in emergency room visits related to respiratory illness, unknown origin, because we don't get definitive diagnosis. It's just the symptoms as they come in. For sick individuals, that is really important, but some people were coming to emergency rooms just to get tested or were mildly ill and just wanted to go someplace where they could get a test quickly, easily, and perhaps were worried about the cost of it. That is why we made a commitment to set up testing sites adjacent to hospitals throughout the state to ensure that we could offload the hospitals with our testing sites and make sure that we had easy access to testing throughout the state to make it much easier and simpler for everyone to get tested. I mean, we have here in Metro Atlanta, we have a lot of places to get tested, commercial and otherwise. But in all parts of the state, you don't have that. So we wanted to make sure we had that availability everywhere, and particularly to offload the hospitals that had so many people in their emergency rooms spilling out, waiting to be seen with serious illness, not just COVID, but other conditions too, because trauma and heart attacks and strokes continue to happen even as we're fighting COVID. And I think it was the right thing to do. I think it was the proactive thing to do. And I talked about it in a number of interviews prior to that press release going out.